certain diseases which are contraindication for heart transplant unless they are rectified. I have talked about concomitant infections. Say for example, if a person is tuberculosis. Unless we treat tuberculosis, we cannot take the person for a heart transplant because he would have to be on immunosuppressant drugs, the medicines which would reduce the immunity and make the infection go flamboyant. The other thing is hepatitis C. There are treatments nowadays for hepatitis C and B which has to be first controlled and then only take for a heart transplant. HIV, again, it has to be adequately controlled. There are certain cancers which have to be adequately treated first and then only considered for heart transplant. I have talked about lung diseases. There are certain lung diseases which can be controlled, in specifically the infections and all, only then we consider for heart transplant. Obesity was another thing. Above 35 BMI is something which is a contraindication. But if a person can behave oneself, reduce the weight and bring it down to less obese level, we can always think about heart transplant. So there are treatments available for certain people who are currently not correct for transplant, but they can be made okay. And I should mention about the uncontrolled diabetes as well. Because once the person is transplanted, the person is going to be on steroids for a while and certain other drugs which can lead to further uncontrolled diabetes. These things have to be first controlled and then only do a transplant. And the last, I would like to mention one more thing, that there are certain concomitant defects. If a person is advanced kidney disease on dialysis or advanced liver disease or cirrhosis and all, there are instances where a single donor liver and heart or kidney and heart transplants have been done together. Even for that matter, lung and heart transplant from the single donor have been done together. So there are situations which can be actually offered to the patient if the person is eligible. But anybody who is more than 70 years, we actually deny transplant because those people at that age would not tolerate a good therapy for immunosuppressions.